So I was asked to present the results of the RGX-111 gene therapy study. The sponsor of the study is REGENXBIO. Bio. And essentially what this is a copy of the iduronidase gene, and it is packaged inside like a delivery truck. The specific name of this delivery vehicle is called AAV9, or adeno-associated virus type 9. It's essentially the shell of a virus that has the infectious parts of the virus taken out. And so essentially you're taking advantage of that virus's protein ability to fuse with cells. And this AAV9 specifically goes to all sorts of different cells in the body, but especially cells in the brain. And so a patient receives a dose of this AAV9 through an injection in the back of the neck. It is guided by what's called an interventional radiologist who uses a CT scanner to really delicately insert a needle into the fluid-filled space that's at the base of the skull. So that sounds a little scary, but the child is asleep during this procedure, and so they're not moving around. And the interventional radiologist is especially trained to get to tough to reach areas. And so using this CT scanner, he can get into these really tough to reach areas. And then slowly the RGX-111 is injected into that fluid-filled space, where the idea then is that it spreads to all over the brain and the spinal cord, and you basically equip the brain with the ability to make the enzyme. And then the idea of the study was to, first of all, see if this is safe. Does it cause any complications? And then ultimately, is it helping to reduce these GAG levels in the spinal fluid in the body? And at the end of the day, is it helping a patient with Hurler syndrome get better from their developmental standpoint and avoid the neurodegeneration? So the presentation today basically talked about or updated what's happening with the study. So far there have been 5 patients dosed as a part of the clinical trial. I also presented the results of what are called a single patient investigational new drug application, and basically that's kind of like a compassionate use application for a patient of mine. There was clearly a family history of Hurler syndrome. Actually, he had 3 older siblings with Hurler's. That's tough. I take care of the older brother, who definitely has a severe Hurler syndrome symptom profile. He had had 2 older brothers who went for stem cell transplant, but because of the ethnic background, no really good matches could be found. So those 2 brothers ended up passing away from transplant-related complications. And when the family had a 4th child with MPS I, obviously I asked them, would you consider stem cell transplant? And they said, given what they had been through, they just couldn't do it again. And so that was the genesis for this. And basically the results that were presented show that this procedure, this injection procedure, is safe. The children are, post-procedure, they go to our intensive care unit. They're kept sedated for a couple of hours so that the area can heal up. and then they're woken up and basically they're up and ready to go and they're eating French fries, and we observe them in the hospital for a couple of days, but truthfully they're actually kind of bored. and you know, they leave the hospital, no complications, you know, no dealing with chemotherapy. Now, we are asking their bodies to make enzyme, which their immune system doesn't recognize. And so for about a year, 48 weeks specifically, the patients who are part of the study take some medicines to suppress their immune system. It's not as strong or heavy as for some other, you know, like for cancer, for other things. But, you know, you kind of want to keep the immune system calm so that it doesn't attack and essentially reject the cells that are making the enzyme. And that's been pretty well tolerated as well. So far, there are 3 children who have some developmental data available from a test called a Bailey, and then there's one older child who's 13, and that they used a different form of assessment. But all in all, it looks very encouraging. The children are making enzyme both in their spinal fluid and in the blood. GAG levels in the spinal fluid and in the urine are going down, or they remain very low. And then developmentally, the children where there's a lot of data, they're progressing in their development. They're not losing skills. And obviously it's very early and there haven't been many patients dosed, but it definitely is very encouraging. And the goal is to have an additional 6 folks with MPS I be enrolled in the study so that they too can receive this treatment and we can assess what happens. Developmental outcomes are tough. You know, a child's development takes months to years to assess. And so the total length of the study, actually for the specific length of the study, it's about 2 years. And then there's what's called a long-term follow-up scheduled for another 3 years after that. Want to make sure and assess that there aren't any sort of longer-term safety issues that come from a gene therapy study. But yeah, the idea is to follow the development over 2 years, you know, perform cognitive assessments every 6 to 12 months to see how they're tracking and developing over time. And, you know, as these children get older, they're going to get to an age where, if untreated, their Hurler syndrome would predict that they would lose neurodevelopmental skills. And so, you know, this study gives an opportunity to see, all right, are these children still progressing in their development, you know, as we're hoping they do, or, you know, are they stagnating or losing skills? The one child that we treated as a part of this compassionate use is now actually 4 years old. And developmentally, he is doing so much better than his older brother at the same age. His mom said that, you know, that he's so different. She was so happy. And so, you know, that gives us all some cautious optimism that it'll do the same for other kids.